Hello and happy Friday. Welcome to the Flint Community Webinar, your community resource every Friday at noon. We're excited to be here with you again this week, and we've got some really cool and important information to share with you. We're going to start with Dr. Allison Mundell, who's an associate professor of epidemiology at that other school, the University of Michigan down the street, our wonderful partner. We've got Kelly Amiru, who's vice president of Health and Information Strategy from NMQF, who's going to tell us about their cancer staging initiative. And we've got Melissa Keikos here with us today, one of my cool partners who's an events manager in our communications, engagement, and outreach department at Michigan State College of Human Medicine, who's going to talk to us a little bit about our teddy bear picnic event that we've got coming up. So we're going to get started. I'm super excited to have Dr. Allison Mundell here with us today. Thank you so much for coming to talk to us a little bit about MyCares and give us a little bit of an update from the things that we've heard from Lee Pierce. So thank you so much.
Yeah, of course. I'm super excited to be here. So let me go ahead and share my screen and see if I can get these slides to work. Let's see. Can you guys all see that?
We can.
Wonderful. Sorry, I have to scooch this thing out of the way so it's here. Okay. So I am here to talk to you about the Michigan Cancer and Research on the Environment Study, or MyCares. So this is a new big study that we are launching, or that we have launched to study environmental risk factors for cancer. And I know that Dr. Lee Pierce came on, I think way back in February, to talk with all of you about this study, but I'm going to go ahead and give a little bit of background about it again in case people missed it or don't remember. But my name is Allison Mundell. As I was introduced, I'm an associate professor of epidemiology at University of Michigan, and I am a cancer epidemiologist. That's sort of my role on this. We have a big team. This is not moving forward. Why is it not? There we go. So just to kind of orient you to the scope of this project, MyCares is one of 5 studies that was funded by the NCI, the National Cancer Institute, and the National Institute of Environmental Health Sciences, kind of jointly to study this from different perspectives. Some of these are also kind of studies like MyCares. Some of them are specific to other subgroups, like, for example, this study is studying just liver cancer. This study over here is studying pregnant women. So we're kind of a general population cohort. And we're really excited to be doing this. Like I said, I'm a cancer epidemiologist, but we have a huge team that we have some environmental folks on the team, some lab-based folks on the team. So we have a really big group who are all kind of coming at this from different perspectives to make this really work and really come together. So what is MyCares? So it's an inclusive cohort that's designed to understand the associations between environmental exposures, intermediate cancer markers, and cancer risk. So it is what we call a prospective cohort study, meaning we're going to enroll people in theory before they have cancer and ask them about all kinds of things that they may have been exposed to, collect a bunch of information, and then follow them over time to see who gets cancer and kind of compare those who were and weren't exposed to see, if people, say, who were exposed to more PFAS or who lived in an area with more air pollution are more likely to get a certain type of cancer than others. That's sort of a basic explanation of the general design of the cohort. And so this is open to all Michiganders between the ages of 25 and 44. And people sometimes go, why that age group? And part of the reason is because, so historically, most big cancer cohorts that have been done have recruited people kind of in middle age, like 50 to 75 maybe, and have asked them at that time point, tell us about your exposure to various things, and then follow them for cancer risk. And there's benefits to doing it that way, right? Because people in that age range are kind of closer to their time in life when they're likely to be developing cancer, so you don't have to wait quite as long in order to study cancer outcomes. This means that this is going to be a very long running study, and it's going to take probably decades before we have really good answers to our questions, but we're going to be able to study kind of exposures at a different time point in life. This age range, this younger adulthood age range, may be when it's really important to assess what people are exposed to. what you're exposed to when you're 50 may not matter so much for your cancer risk. Maybe it's really what you're exposed to younger. And so this is giving us a kind of a different window of exposure to really study. We're also really committed to recruiting a diverse cohort. We are planning to have at least 75,000 Black, Latinx, and MENA, Middle Eastern, North African participants, so that we can understand their unique exposures and also health experiences. So why Michigan? This was a big part of our pitch to NCI when we were trying to get funded for this study, that Michigan is actually a really important place to study these exposures because it's been the site of a lot of environmental catastrophes, going all the way back to the 1970s when there was a contamination of animal feed with PBB that then caused poisoning in the food chain. Of course, the Flint water crisis, with which we're all very familiar. We also have some of the highest PFAS levels in the United States. So many of the highest contaminated PFAS areas in the United States are in Michigan. And we also have high air pollution levels. And so really, it's unfortunately a good place to study these exposures and a really important place to study these exposures. Sorry, I have a loud, kind of angry, small coworker downstairs. I apologize.
No worries.
And so this is, of course, a map of Michigan. And part of it, we're really targeting certain areas that we're calling hotspots or environmental injustice hotspots. So there's this environmental injustice score. I have another slide at the end if people are interested in seeing how that's calculated. But essentially, it's a score that's been developed to calculate environmental injustice. And it takes into account like the people who live there, as well as proximity to pollution and that kind of thing. But these are the hotspots that we're really targeting, although we're welcoming participation from the entirety of the state, but we're really working to recruit from these areas because we think that there are important environmental exposures in those areas that should be studied. So what are we asking participants to do? Well, we're asking people to complete a survey at the beginning of the study, and I'm going to show you a little bit later. We've actually updated our survey quite extensively as of April of this year. So we got a lot of feedback from people about what was annoying about the survey or what was difficult to do. And so we've actually broken it into 6 modules, which I'm going to show you a little bit later. And so the first thing you would do is you would consent, you would provide informed consent to be in the study. You would have to read through the consent documents, and that takes about 10 minutes to kind of understand what the study is and provide consent. And then each of the following 6 survey modules takes about 10 minutes to complete. So we've come up with this little slogan, which I think is very nice, which 10 minutes a day for 1 week will provide a lifetime of knowledge. So it's kind of the initial commitment. We're also asking people who reside in certain zip codes in these hotspots in particular, if they would be willing to provide a blood and a saliva sample. The blood sample is actually those finger stick ones where you put spots on a card. So it's not like a blood draw that anybody has to go anywhere for. It's the study is actually fully remote. We would mail the kit and you would do the blood and saliva samples. And then we have a system now that we've worked out where people would sign up for a time slot for someone to come pick the samples up from you. But that is entirely voluntary. Like you don't have to do a lot of people will only be doing the survey. People can still be in the study and complete the survey without doing the biosamples part. We're interested in hearing also from participants what research questions matter to them, and also we're going to have some annual follow-up questionnaires that we're interested in. I'm going to talk to you about kind of the first 2 follow-up questionnaires that we're just starting to launch because we have our first wave of participants who have been in the study for a year now. And each person, when they complete the survey, gets a $10 thank you, like a Visa gift card kind of thing. We also are providing everybody who completes the survey with a referral code, and anybody that you give your referral code to who then completes the survey with your code will also get $10, and you will get $5 for referring them. And then we're also providing, we've partnered with local organizations, and at the end, people who finish the survey have a chance to pick which organization they'd like to donate to. And for each person who completes the survey, the study is donating 50 cents to that organization. the questionnaires ask about, we're getting a lifetime residential history. So we're asking about all of the places that you have lived. And we'll talk a little bit more about why that's important on the next slide. We're asking about your background, various chemical exposures, like do you use pesticides around your house? Have you done a lot of painting in your house recently? That kind of thing. Personal product use, personal health and wellness, and lifestyle factors. In those blood and saliva samples, this is where we're going to be getting some of those potential intermediate markers of cancer risk. We're going to be looking at stress and inflammation markers, but we're also going to be getting some information on potential exposures like heavy metals. We're going to be looking at PFAS chemicals in the blood, immune function, biologic aging, and also something called metabolomics that some of you may be familiar with. Basically, this is kind of measuring all of the metabolites in the blood that are of a particular size. And what that will help us do is understand kind of how exposures are maybe changing the way your body's metabolizing things. And so this is what we will gather. So once we get all that information from participants, especially the address history, we can get information on like kind of community level pollution measures, right? And link that to people's addresses, and therefore kind of build out kind of a lifetime exposure to all of these different potential sources of environmental exposures. So we can get information on heavy metals, air quality, green space and walkability of neighborhoods, noise levels in a neighborhood, PFAS contamination in water sources. And then we're going to find out if people have been diagnosed with cancer, partly by asking on follow-up surveys. We'll ask, you know, have you been diagnosed with cancer since the last survey? But more importantly, we will be linking with the Michigan Cancer Registry. So even if people fill out the baseline questionnaire and I guess never communicate with us again, we would be able to find out if they had cancer from the registry. So these are our goals. We really want to assess the impact of toxic environmental exposures and pollutants on health, primarily cancer and maybe intermediate cancer outcomes. We really want to work with the community to understand and answer their questions. And we want to inform the community about new environmental exposures and findings related to those. We want to tell communities what we discover, and we want to generate the scientific evidence that can be used to force policy change. And, you know, in addition to, so we really feel like we have some return of value that we've been able to give to participants. So this is for the individuals. We have that $10 incentive and $5 referral, which we realize is not an enormous amount of money, but we hope that it, you know, acknowledges the time that people spent. We're doing that donation to local organizations that I mentioned. And we're also working on, for people who are participating in the biospecimens, we're working on ways to return those laboratory results to people in a meaningful way. And also we're working on some way to, you know, once we kind of gather that data on community level exposures, we're working on some way to potentially provide that information back to people about their communities. We're also hoping to have some community return of value. So I know you guys are, we know you guys are interested in webinars because you're here. So we also are starting a webinar series. We've conducted 3 of them so far, and we've sort of taken a break from doing that for the summer because we're a little bit more tied to a academic year, I suppose. So we've taken a little break from those over the summer, but we're going to start getting those back up and running very soon. We also have these things that we're talking about, science you can use and environmental fact or fiction, and I'll show you examples of those, but these are ways to kind of give information back to the community about environmental exposures and potentially cancer risk. And we're also participating in health fairs. So we were actually present in other community events, and I have some pictures of that in a few slides, but we were actually at the Flint Community Health Fair that occurred back on, I believe, Martin Luther King Day earlier this year. And we're also going to be at the upcoming cancer screening health fair that's happening, I believe, August 26th. That's being run by the National Minority Quality Forum.
Yes.
Forum. Thank you. I'm so sorry. So that is, we are also going to have a booth there. So if anybody wants to come up and talk to us, If you have additional questions that we can't answer today, we're absolutely happy to do that. So here are some examples of the webinars that we have had. We had one on why colon cancer is becoming more common in young adults, because that's a very big ongoing problem. They actually recently lowered the screening age for colorectal cancer from 50 to 45 in response to this kind of growing problem. And so Dr. Stoffel is amazing, and she is studying this problem. She's a clinician who also treats colon cancer patients, and she runs the the genetic cancer risk clinic. So she's great, and we had her come talk. We had John Meager, who is one of our team members, come talk to us about microplastics and what it means that microplastics are being found in our bloodstream. And then we had Alexandra White come. She is at the National Institutes of Health as an intramural researcher there. So she works for NIH and does research. And she was recently the lead author on a paper that found that some hair products, particularly chemical hair straighteners, may be related to the risk of uterine cancer. And so she came and talked about this issue in the webinar. We are also putting out this My Cares Bulletin every month. We have a newsletter that we put out every month. It has community spotlights. We're spotlighting a community partner every month. We're spotlighting some of our team members every month. We include usually one of those fact or fiction kind of things, or a visual abstract. And we have updates about the study. So this is an example of one of those kind of cancer science you can use visual abstracts that we put together on hair straighteners, relaxers, or pressing products increasing potentially the risk of uterine cancer. So, what is cancer? What is uterine cancer, and what was found? So double the cases of uterine cancers were found in women who used straightening products by the age of 70 compared to women who didn't use these products. And then this is some stuff that you can do, right, to kind of reduce your risk if you use these products. So we hope that this is sort of a useful thing to give back to communities. This is an example of fact or fiction about skin cancer. And, so the idea is it's important to examine your skin at least once a month to check for any abnormalities. And that's a fact. So you should be doing that. And then, so this is a little thing about skin cancer. Everybody should be using sunscreen.
These are so cool. Like, where do you put these? Like, how do you disseminate them?
Yeah, so I can actually show you where these are if you want. Let me see, I can stop sharing that and let me go to our website, mycares.health. And so this is our study website. This is where people go, if they'd like to enroll, they can do that here, but we have a bunch of stuff up here, including our resources page.
Yeah.
Click on that. There's you can choose any of these things, right? So this is our newsletter here, but here's our one about colon cancer becoming more common. Here's the uterine cancer one. We have our videos of our webinars. Here's about microplastics. We have some of our news coverage here. So we need, this is where we are putting these things, and we're working on updating this a bit, but yeah, so this is where those are going, and they are showing up in the newsletters as well.
Awesome.
Yep. So we hope you'll go there and take a peek at those. Sorry, I have to reshare.
I know.
Now we're moving.
I'm sorry, I threw you off and I made you.
Oh, absolutely not. I'm happy to do it. Yeah, so I think these are really cool. I didn't make them, so I'm very impressed. Like the students, we've had some student workers who've helped us out with these, and some of our PhD students have made these, and I think they're really amazing. So I'm very impressed with all that they've done on this.
These are quite nice.
Oops.
Yeah.
Sorry. Yep. So these are some of the booths we've done and examples of us getting out in the community. I did not actually include a picture of us at the Flint Cancer or Health Fair, but I promise we were there. I swear. We were right next to the giant colon in the back. So we're also becoming involved in the community in other ways. We're working with Heather Lynn and others to work on a unusual cancer pattern study that's been put together with the Flint Community Cancer Consortium, which I think is something that can really give answers back kind of in an immediate way to the Flint community about something that they're very concerned about. And then kind of the longer term answers will be able to come from My Cares, we hope. And this is just a document that we have put together to share with our community partners. I realize this is a little bit busy, but if anybody would like me to share this with you, we're happy to. This is kind of all of the ways that we hope that community partners will work with us and what we give to you and what community partners give to us. So we've also, since we spoke with you guys last, have put together what we're calling the My Cares Council. So this is a group of kind of advisors, I suppose, who are both from, kind of from a mix of backgrounds, like so people from the scientific background, from the scientific point of view, people who are community activists, people who are working with government. And so I think we have a really good group of people who are going to provide us with a lot of feedback about how we can best move forward as we're moving, becoming larger and becoming more established. Again, so angry. I'm so sorry. Somebody must have had the audacity to walk on the other side of the street from our house, as if they don't know that belongs to my dog.
How dare they interrupt our conversation?
Very dare they. So yeah, so this is our council so far. We're hoping to get additional members, maybe who are from other communities that we're recruiting from, but this is where we're at, and I think we've got a good group so far.
Allison, can you tell us, if you go back to the council, what is your hope for the council's, what do you hope the council will accomplish?
Yeah, I mean, I hope that, from the scientific perspective, I think we want to have these people in the room because we want to make sure that we are being responsive to communities' needs, that we are thoughtful about how we can become involved in policy making issues, and that we are also being thoughtful about the science that we're doing, and that we're not kind of missing out on some important research question that we should be answering. And, we were thinking at some point of having kind of a scientific council and a community council separately, but a lot of the feedback we got was that it would be really good to have all those people in the room at the same time, right? Because to make sure that everybody can discuss together, right? And so I think that is kind of the goal.
I think one of the unique ideas and what makes My Care so special is that there's so much one-to-one interaction with participants, right? We are so used to disseminating surveys via online, but there are all of these touch points in which you engage with community members. And then you've added this extra layer of being really thoughtful about making sure you're asking the right scientific questions and including community. I wonder if you've heard any feedback or you've gotten any feedback from community about how this is going so far and how your response has been to that.
So we have not yet. So we actually have just established the council. We've not actually even started having regular meetings yet. That is something I'm planning to do this fall. We just kind of got this worked out in the last month or so. So this is hot off the presses. I think other studies have done this, particularly studies who do have the goal of enrolling, diverse communities and enrolling a diverse sample. And I think it has been really helpful. And I think from, people who have done this with other studies, that's from whom we were getting some of that feedback, that having kind of everybody together would be really good. So I hope next time I come talk to you, I have a good answer to that question. Right now, we're still new, and I do think it's the right. I think it's in theory, the right thing, and I think particularly with the right group of people, which I think we've really tried to curate a good group of people here. I think it's going to be really good.
But you've also, this is so interesting to me because the work of even our webinar and the work that we all do is about making sure that as academics, our science is with community, is a part of community, is meeting community need. But I love that you've got like a political strategist on board to think about, you know, what do we need to be advocating for? What policy objectives do we need to be thinking about? You know, you've got community engagement. It's just a really cool and thorough approach. And I felt necessary to highlight that.
Thank you. I appreciate that. It's definitely what we're going for. You know, Lee and I are, you know, some of the leaders on the team in terms of the science, and some of the community-based stuff is a little bit outside of our usual, right? It's a little bit outside our comfort zone. So we're still learning about it. So I really appreciate hearing that you think we're taking the right approach. I mean, we obviously have people on the team for whom that's their bread and butter. Heather Lind is also working with us on this as well. So, and that's certainly her area of expertise, but I appreciate that. I appreciate that. Thank you.
And you've brought like the different schools together too. So you're like bridging gaps all across the world.
I didn't feel any animosity. I'm actually not a football fan. So it's
the game is on our side of the state this time. So
okay.
I'm sorry, you can keep going.
That just means to me, that means my traffic will be better at some point. All right. So a little bit of update then on recruitment. Love this picture. So excited about this picture. So mid-April, this little gray box here shows you when we made some very important changes. We actually kind of took down our survey in October, and it took us longer than we had hoped to really get it up and running again with the changes. But mid-April is when we launched our new and improved survey, and we launched our new incentive structure that provided that $10 incentive to everybody who completed the survey, and our $5 sort of snowball recruitment incentive. So our total enrollment as of a couple of weeks ago was 3,470. So you can see we really have done a lot this summer in terms of, I think enrollment is really starting to take off. And we're very excited about that. This is what the new dashboard looks like for our survey. So this is an example of what it would look like when you're kind of partway through it. After you've gone through the consent process, you would be taken to kind of this dashboard, which shows you the sign up, which is your consent part. And then these are the 6, your background, where you've lived, your environment, your health, lifestyle, and your well-being. And so you can see when you've completed it, you get the little green check mark. And when you come back to the dashboard after you complete it, there's this little kind of animation that shows you, like, it has confetti. It makes me happy. I don't know. It makes me feel like I've accomplished something when I come like, oh, yay, me, I did another section. And then you can see, you know, this is the next one that you would need to start. And then, you know, it's saying these are next, and they'll take about 10 minutes a piece. So
can you pause on one? Like, can you like complete part of it and then move on?
I think so. I think if you complete part of it and leave, it'll be completed up to where you stopped. But that's part of why we wanted to put it in these little chunkers, because you can complete one chunker and then come back and then do the next one next time. Do not have to do all 6 at once. And that's, I think having it in pieces that take about 10 minutes a piece really helps people kind of know where they're at in the process. It's not just a long and never-ending survey that keeps going and going. And I think our completion rates have really borne out that this is better. With the old survey, we were only getting about 33% completion. I think people were just getting fed up, right? Because it was too burdensome. And with our new survey, we're getting 80% completion. So I think that's really,
wow.
I think that's really good.
Your survey designers have to be ecstatic, because that's a nice.
Yeah. Yes, we're very excited. I think it also is probably the incentive. The new incentive is also helping. I think it's both together. Sure. But yes, I think this is we're very pleased with how much nicer this is. And we're hoping that as we add follow-up modules, which we're now working on, I believe I have that. And this is how we got our little 10 minutes a day for 1 week leads to a lifetime of knowledge, which I'm always so impressed with somebody who comes up with these cool slogans, because that is not my area. People who come up with like cool names for the studies and the cool little slogans. I'm like, oh, that's amazing. Look at that. That's so cool. So I'm
glad that's someone else's job, right? I get it.
And we're going to hopefully have these surveys kind of show up on the table of contents as well. And the 2 year 1 follow-up surveys that we have just finished designing and that we're starting to actually implement and put onto the website we're doing a deeper dive into family history of cancer. So we're going to be asking everybody about their first degree relatives, which means parents, siblings, and children. We're going to be asking which cancers these people have had and age at diagnosis, among a few other questions as well. And then I have recently, this is my white whale this summer. I have been working very hard on doing this water exposures questionnaire, not only drinking water exposures, including some more detailed questions about like if the water at a person's home is filtered or not and in what way. Also bathing and showering and swimming, because, you know, even when, you know, every time you bathe and shower, you're exposed to the chemicals in that water. And it actually matters like how long your showers are. Baths and showers are different, and the temperature at which you like to keep your shower. I personally like to boil myself when I have a shower. I'm a very hot shower kind of person. Everybody tells me not to do that, and I don't listen.
You're in good company.
But you know, like how hot you like it. And then recreational swimming too, because of all the chlorine in swimming pools, that can also be a interesting route of exposure. And then the other thing that people really have not done before that has been interesting to try to implement has been this recreationally caught fish consumption questionnaire. So, you know, we're all very proud of our lakes and rivers in Michigan. A lot of people like to go fishing and eat the fish that they catch. But there's a whole, you know, the Michigan Department of Health has done a lot of work on like measuring chemicals in fish from various places. So we have a pretty detailed survey on that in there. So I think some of our wins have been, you know, we've really started to, our enrollment really is beginning to snowball. We're getting some traction and really increasing our enrollment. I think that $10 incentive and $5 referral incentive have been very successful, and our new survey is much nicer to use. Some challenges that we've encountered is, you know, as we've talked to people in the community, we have learned that some people in our target population really may prefer paper surveys. And so we have been developing a paper version of our survey, and we're thinking of sending that out to a group of people as well to see if we get kind of better uptake that way.
Do you have any sense of why paper surveys are, for your target population, particularly popular? Is it?
No, I don't know why exactly. I know that we were talking, I think, and I'm going to get the name wrong because I didn't actually have this conversation and I always forget what the group was, but I think it's CHAST that's in Detroit that works with Latinx communities. And they said that for whatever reason, their population tends to prefer a paper survey. And I think as we were talking with like the Flint Cancer Registry as well, that they said that they had some luck mailing surveys to people. Now their age group may have been older as well, and ours is somewhat younger, which we would think that the 25 to 44-year-old, I can talk about them as a them now. I'm no longer in that group. But those young folks, they tend to like electronic versions better maybe, but you know, it may be that, you know, some people just prefer paper. So, you know, I don't think we'll know until we try.
Yeah, no, it makes
the assumption that in this age group, electronic would be everybody's preference, but perhaps not.
Interesting.
So what are we doing right now, and what are kind of our future strategies? Right now, we are emailing to a bunch of listservs, people who are licensed to do any kind of job in the state of Michigan. If you have a state licensure for your position, those email addresses are actually publicly available. So we've actually been emailing to those folks. We have emailed to, obviously, the University of Michigan students. We're working on emailing to faculty and staff, and we're working on doing this in other, like UM Dearborn and Flint, and potentially other universities in the area, or in the state, sorry. We are attending community events, like I said. We're doing a lot. We're trying to increase our social media presence, and we're working on snowballing with our $5 referral incentive, which I think is working pretty nicely. We are in the future planning a media partnership with MLive. So they have sort of a whole suite of advertising options. One of the things we're thinking of doing is a 24-hour takeover of their website, so that like all the ads on the MLive website are for My Cares, which I think would be cool. We're trying to develop partnerships with unions. So for example, the Service Workers Union, SEIU, we have emailed we've been having conversations with somebody in that organization, and they think that their members might be interested. So kind of the ask with that would be, would you be willing to send out this email inviting people, to your membership, essentially inviting people to join the study. We're interested in developing corporate partnerships, although that has not yet happened. But I think there are a lot of companies that are Michigan based that would have a lot of stake in presenting themselves and who are already involved in trying to improve like chemical exposures and environmental friendliness in Michigan. So I think we're interested in working with that. We're interested in working also with potentially VIP and talent partners. And again, working on that paper survey to reach communities and individuals that may prefer this approach. But we're definitely interested in hearing other ideas from the community. Like if there's some obvious thing that we've missed that you're like, why aren't you going and doing this thing? We would absolutely be thrilled to hear any ideas that community members have about this. So that's it. That's our update and a little bit about what we are doing. So thank you so much. And I'm happy to take any questions. I don't know how this usually works. I don't know if you usually do.
No, this has been awesome. Thank you so much for this really thoughtful overview. I think it really hits on the things that as a community member, you would want to know about an important study that's available to you. Always put information in the chat. You mentioned this idea that you're thinking a little bit about how to get lab results back to people. And I wonder if you could give just a little bit more information about, in your head, how do you see that working? Like, would you partner with local clinicians to like go over those with them?
Yeah, that's the issue, right? Is that some of these things, like for example, okay, lead levels, right? That is a thing that is, we have knowledge about, like, if you're over this, you should be seeking this kind of help, right? So that's, there's evidence-based recommendations for what to do based on a particular level. But like PFAS levels, there's not, right? I mean, you can say, oh, that's higher than someone else's, but it's difficult to know what that means. And if you should do anything about it, I don't think there's anything to do about it. So for things like that, I think we're much less comfortable giving those results back to people because we have no follow-up and no recommendations to give them about what to do with that information. And I think it's irresponsible to give that information to people and just be like, good luck, that might be bad. We don't know, So I think as more information comes about what the actual link is with health risks and what you might be able to do about something like that, we would give those back. But I think we're thinking more along the lines of results with which you could do something, the lead being one of the ones that, and I see somebody did mention lead-based paint hazard control in the chat. I assume in reference to things that people are, that could be an interesting webinar topic or information you can use kind of topic for sure.
Absolutely. And obviously we would have you back to talk about all of your expertise, right? Like you've got so much and we're excited to bring you back. There was one last question in the chat that I really want to make sure we think about. Is there a deadline for participants to sign up?
No. So right now it is ongoing. We are in the process of, in theory, our recruitment phase would be for at least another 4 years. So definitely
sign up.
We would love for you to sign up sooner rather than later, but if there's a reason you'd like to wait, you have a little time for sure.
Super appreciate you and all your support and your time. We will be inviting you back. Thank you. And any last words or comments you want to leave people with to remind them about MyCares?
I would just say, if you're interested, go check out our website, take a look at the webinars we've done before. There is a contact us button on the website. So if you're interested, if you do join the study as a participant, you would obviously get information from us about our webinars and you would get our newsletters. But if you are just interested in receiving that information and you don't necessarily want to join right now, or you're outside our age range, then for sure contact us and you can sign up to receive our webinar notices and our newsletters that way. So we'd be happy to. We definitely want to share information with everybody, even if they aren't interested in signing up right now.
Thank you. And if I don't see you before the game, I have to say it, go green. So
sounds good. It's a weird town to live in if you're not a sports fan.
No worries. Thank you. All right, Kalilai, I see you smiling, so you better be a Spartan fan. Like, that's the rule. Like, Where are we going with this?
I'm afraid I'm going to complicate things. I went to the University of Minnesota, so.
Okay. You're still in the Big Ten, which is like evolving into some weird thing right now, but you're still part of the team. It's fine.
Absolutely.
How are you?
Doing very well. Thank you for having me.
So we get to continue this conversation about being really thoughtful about preventative screening, thinking about cancer risk, and you're part of NMQF, the National Minority Quality Forum. Before we get into talking about your cancer stage initiative, can you talk a little bit about NMQF?
Absolutely. So here, let me pull up my slides as well. Perfect. I hope that you could see it. Let me know if you can't. So the National Minority Equality Forum is a nonprofit organization based out of Washington, D.C. We have a focus on data, research, education, as well as advocacy. It's been around for about 2 decades. I think in 1998 is when the organization formed, and the mission really is to reimagine the healthcare system so that it's focused on conserving high quality and long lives for all. And we have a particular passion for serving underrepresented groups and communities like Flint. So as I said, it's been around for 2 decades. And this is really an organization that came about from the community, for the community, and committed to helping improve the quality and outcomes across disease states. Our particular initiative that I'll be talking about today is focused on cancer, but we work across different disease states, whether it's diabetes, hypertension, and multiple others.
Thank you so much. Okay, and so you're not quite in presentation mode. You can, if you do your presentation mode, then we can see it all big for those of us who are visually not as astute is what I'll describe that as.
How about this?
So all of that background, super cool. Tell us a little bit about the Cancer Staging Initiative.
Yeah, so the Cancer Stage Shifting Initiative came about from the Cancer Moonshot. And the Cancer Moonshot is President Biden's national goal that actually started under President Obama's administration. So that we're currently in the 2.0, so the Cancer Moonshot 2.0, but has similar goals in that its overall objective is to cut down the cancer death rate by 50%, in the next quarter century, so 25 years. If you think about the cancer rate, it's estimated, the estimated cancer death rate for 2022 is 609,000 people. So they'll go back and do some analysis and see actually how many people actually died. But the estimate was 609,000 people would have died from cancer just in 2022. And so this goal, based on that number, is to try and cut that down by half. And the way you do that is, again, as you mentioned, is by diagnosing cancer earlier, getting more people screened, and making treatments available to those patients so that it's not only diagnosed earlier, but treated earlier for better outcome. So our Cancer Stage Shifting Initiative was inspired by that goal. I believe we were actually contacted by the White House to work with Flint, in Flint, due to a number of concerns, including the environmental concern, the lead and the water issue. So that's when CSSI formed, and our mission is, it aligns with the moonshot in that we want to move the late stage to early stage cancer diagnosis and treatment. And we have a very focus in historically marginalized communities and underrepresented populations. So the pilot actually started in Flint. And so what we're hoping to do is take this model, take this blueprint, if you will, and expand to other cities that are facing similar challenges.
So tell me a little bit about that, what that looks like in terms of, I get big picture, right? We want to decrease cancer death rate by 50%. We're focusing on death, not necessarily other outcomes, morbidity, but we're focusing on, actual mortality related to cancers and trying to decrease those by 50% in the next 25 years. We do that by shifting and identifying cancers early. What does that look like in terms of your engagement in the community? How do you do that?
Okay, so we've got, so let me talk about our metrics of success, if you will. So how do you achieve the overarching goal that we have to cut down cancer death rate? We've set the metrics of success for ourselves so that we're actually statistically improving the numbers and increasing the number of patients that are screened using traditional methods, as well as the more innovative multi-cancer early detection screenings that are now available, and doing a number of pilot projects that are hyper local and focused in communities in geographies that we know already from looking at data have a higher prevalence of cancer, already struggle with the environmental exposure. And so that's the way we do it. So to answer your question more specifically, we believe in establishing credibility and building trust with communities. And one of the ways we do that is we look at the data, we go into communities, we speak to communities through various listening sessions, sitting in and to community meetings, having discussions, and really engaging with community to see what the needs are, to see what we could provide. I can tell you, after having done multiple listening sessions in Flint, these were some of the key findings, and it touches on everything that we're discussing here. So there's a huge environmental concern. The community is not only seeing a higher cancer incidence rate, but the community believes, and there's a concern with the link to the environmental concerns. And so that's something that we're looking to see what we could, how we could contribute to see if that's an actual cause. So there is a number of concerns that were pointed out by the community, including some of the challenges as far as navigating the health system. How do you go from being screened to the diagnosis and finding treatments that are available, or finding cancer centers? And so these are some of the challenges that were highlighted. So there's access to the healthcare, there's the knowledge, the literacy, the awareness, also the trust factor. So this is a community that's got concerns around trust and trusting those that are supposed to care for the community because of the historical context of everything. So we're trying to really play a role in which that we could make sure we are bringing that, not only the cancer innovation, but the available tools that are there that can help communities like Flint.
Can you tell me, so you describe this idea of trust, right? And if you are an organization that works with community, how do you build that trust, right? Because you bring all this incredible expertise and knowledge and resources, and you want to make sure that these are available to the community. But there is that element of having to bridge that gap, right? Of having to maybe identify trusted people in the community, and maybe tell us a little bit about what that's looked like.
Well, I believe it starts with just putting aside our preconceived ideas on even looking at the numbers. We knew before going into a community like Flint, we could look at the cancer rates, the prevalence, and see that it's high. And we could tell the number of patients that are being screened for cancer is low. So, but even understanding and knowing that, we go into a community like Flint with open mind into truly listening to what the concerns of the communities are. And that's the reason why we've done these listening sessions, to really hear the community on, here's what we're seeing, what is the community feeling, and what are their true concerns. And it was no surprise to find that there was challenges around every single topic that we just mentioned, not only trusting the health system, accessing it, understanding what the cancer is and the cause of the cancer and why everyone is seeing. At one point at one of the listening sessions, to paint the picture for you, Jennifer, we asked how many people in the room that we had, and there was over 40 people in that room, have personal experience with cancer or have had an immediate family member touched by cancer. And I want to say almost 80% of that room raised their hand. So it's truly by being hyperlocal and listening to the needs of the community that we begin to build that trust and establishing our credibility, and then bringing in those that are experts in that cancer and have the treatments available, and making sure that connection is happening, but with us overseeing it to make sure that that trust is there and the community isn't being harmed and the data is being shared with the community, and the solution that's being integrated and implemented has the community involvement. I think that's often the big piece that's missing.
That's really amazing. I didn't mean to overshadow your next slide. So
no, you're good. You're good. So this is just this from the first health screening that happened. I believe Allison actually touched on it because my cares were there, and so were a number of other partners who came to the health fair. So after the listening session, one thing we understood was there was a clear need to have screenings, and one of the best ways to have screenings or even introduce the community to what cancer resources are available. How do you go about being screened? What are the health systems that are near you or the cancer centers? Was to do a health fair. So we started with the health fair in January, and over 500 people were served. You can see the numbers here. Not only were there screenings, but there were vision tests, and that had a focus more on colorectal cancer. And there were a number of referrals that were made for colorectal cancer for patients who had medium to high risk and were provided follow-up care. So these are the type of events that we do to partly answer the question. And on this slide, what you're seeing here is our proposed idea of how do you then go a step ahead and make sure that change is sustainable. This is our proposed answer to staying the course in Flint, because we're a small organization. We've got plans in expanding this work that we're doing to other communities. We are being invited to Houston and Chicago and other cities all across the nation. So, but what we don't want to do is just come there, have a presence, and leave. So what we're proposing is, and we're working with a number of partners who are already making this possible, is to have some sort of a community-based coalition, so that even if NMQF is in other cities or working in other cities, that these communities have something that's community-based. And we have 3 strategies for this. So the core strategy being 3 different units, one that does the community advocacy and educating and galvanizing the community around awareness and education. The second one, having a health professional that can actually navigate the community around how do you go about screening, or from screening, if you've been diagnosed, how do you navigate the health system so that you get the appropriate follow-up and care. And then finally, we've noticed as well that it was important to have people access the resources that are available, because there's a lot of people who said, I don't know what's available. I don't know how to access what's available. So the resource accessibility being the third piece on putting together what's available and how people can go about accessing that.
This is such really important information. Yes, let's go through the upcoming the upcoming the health fair screening. We're so excited about this.
So the health fair, so this is the second one. It's going to be even larger than the first one. I know Allison mentioned it. You mentioned it as well, Jennifer. So let me go back to present mode.
Yes, let's get it big.
So yes,
yes.
we have next Saturday on August 26th, we're sponsoring a huge health fair, and it's aligned and with Northern High School class reunion. And one thing that's actually exciting and unique about that is not only do they draw, it's expected 2,500 people will show up to this event, but you also have the range of graduates from 1950s to the 2000s. So you're going to have multiple generations, people across various ages. So it'll be a unique opportunity for healthcare to be brought to people versus people and patients going to healthcare. So we've got a number of partners that will be providing not only free screenings for colorectal cancer, breast and lung cancer screening, education and awareness around just about every chronic disease. How do you navigate the health coverage, the insurance piece, vision test, diabetes, and multiple others. So we're super excited. We're asking for people in the communities to come out. There will be so patients will actually, attendees will be invited to go around the health fair, and we have the incentives as far as food trucks and t-shirts and giveaways. So cool. I'm super excited. It's going to be a great event. Yes.
Kalalai, thank you so much. I didn't realize it was the reunion. It aligned with the class reunion. Blah, 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 blah. I didn't realize it aligned with the class reunion of Flint Northern. I think you might have created another rivalry issue here, but we'll I got a couple of people on my team who will take offense, but it's fine.
We want to create these positive rivalries, right? Let's see who can get more people screened and advocate for this cause. So I'll be remiss if I didn't thank our partner Genentech, FC3, the Flint Cancer Consortium that was mentioned here, Arthur Woodson, the community advocate, and Nurse T as well.
Nurse T, we always got to thank Nurse T, and shout out to Art. Thank you so much, Kalalai. We appreciate you.
Thank you.
Okay. All right, we're going to end with more preventative information. I got my colleague, Melissa Kakos, who's going to talk to us a little bit about an event that we've got September 9th. Melissa, take it away.
Yes, hello, I'm Melissa Kakos. I am a Spartan, so go white to you.
Go green.
I am the events manager at the MSU College of Human Medicine External Relations Unit. I work in Grand Rapids, but I'm the events manager for all 8 of our campuses across the state of Michigan. So I am here to talk about the Teddy Bear Picnic. You can see the flyer right here on the screen. It is taking place on Saturday, September 9th. From 11 a.m. to 2 p.m. at Mott Park Recreation Area. So the Teddy Bear Picnic is a free community event, and it's held to help children understand the importance of health and well-being and provide a fun and safe environment for them to interact with doctors, healthcare providers, and first responders. It's kind of a way to help children overcome the fear of going to the doctor. So we have mock clinics set up where they can interact with doctors. And then we have also brought in first responders. So at this one, there will be the Flint Fire Department will be there, so they can have fire truck exploration, and the police department, should they ever have to encounter any of the first responders, they know that they're there for them. But this is specifically to help them. So they are encouraged to bring their teddy bear for a checkup. We are going to have a number of, I'm actually going to read off the list that we have here. Of community members that are going to be involved in this. So the MSU Charles Stewart Mott Department of Public Health. We will have Capital Area Therapy Pets there with 3 of their dogs. Big Brothers Big Sisters of Flint and Genesee County, Ennis Center for Children, Michigan State University Extension, MSU CHM Flint Pediatric Interest Group they'll be talking about nutrition, Michigan Department of Health and Human Services, the Division of Environmental Health, GISD Early Childhood Programs, City of Flint Public Health Office, Communities First, Hurley Children's Hospital. So they were also there last year, and they will be doing the mock clinics for the children. The Crim Fitness Foundation, the Flint Registry, they have an awesome booth every year, so make sure you stop by their booth. And then, like I mentioned, the City of Flint Fire Department and the Police Department. And then Blue Cross Complete of Michigan. We will have 2 healthy food trucks there. Haggerty's is actually from Grand Rapids, but then Thrive Acai is from Flint. And then another important thing to note is that we partner with Alana's Foundation, and they partner with the Visiting Nurses Association, so we can provide free flu vaccinations to anybody that wants them. So flu season is just around the corner, and they will provide free flu vaccinations. If you are uninsured or underinsured, they cover the cost for you. And if you are insured, you can work with you can have your insurance company. So this is a very popular event. This has been going on in East Lansing for 17 years. We get anywhere from 800 to 1,000 people there. We held this event for the first time in Flint last year, and we had nearly 200 people there, which we were very happy with for the first time in Flint. So again, that's Saturday, September 9th. And I also wanted to mention that so Lisa Passberg, she's actually on this webinar right now. She works at the Flint Registry, and she has helped me a lot with getting the word out for the teddy bear picnic. She is holding a teddy bear donation drive from now until September 8th, which is the day before. So if you have any gently used teddy bears or stuffed animals at all that you want to donate, we will give these away at the teddy bear picnic for any child that does not have a teddy bear or stuffed animal. So there are donation boxes on the 1st and 2nd floors of the MSU College of Human Medicine building in downtown Flint. And there are also boxes at Mott Park Clubhouse and the Somerset Salon and Spa. So, and if you have any questions, please, Jen, I don't know how you provide information on these, but anyone can email me or call me.
In the chat.
Okay, I will. So please send, we have a website and a Facebook event. Please share this with everyone. If you know of any local schools or pediatric offices or anything that I can send the flyer to, please send it along. I would be happy to share it with the whole community of Flint. We want everyone there. So yeah, I think that is it, unless you have any questions.
I do not. Thank you so much, Melissa. We super appreciate you. Everyone, have a really great weekend. Get to the teddy bear picnic if you can. Get to the NMQF health fair if you can. We'll see you next week. A reminder about C's for community health workers.